It is very important to pre-oxygenate the patient before starting the procedure. Once you pre-oxygenate the patient 5 to 10 minutes before starting the procedure, then you arrange the article, ABG pre-test and post-test ABG syringes, then arterial line, then every monitor should be in the place. Collect the ABG sample, sent to the lab. This is you can consider as a pre-test ABG. Then you connect the suction catheter through the oxygen source with high flow oxygen, that is 10 to 15 liters of oxygen. Connect with the suction catheter. Maybe the 14 gauge to 16 gauge catheter is enough to do that. Insufflate the oxygen at the level of carina. Then you calculate the time as per the watch. The stopwatch is mandatory before starting the procedure. Collect this stopwatch before doing this procedure. Monitor the time carefully. Observe for the respiratory movement. Should carefully monitor for the any respiratory effort or respiratory movement from the patient. If you found anything respiratory movement or just rise or just fall, this maybe the test will be considered as a negative. Insufflate the oxygen. Carefully monitor the oxygen insufflation devices. Sometimes dislodges may end up in the wrong values. Monitor for the cardiac multipara monitors, multipara values, heart rate, saturation, blood pressure, temperature, and respiratory effort. The monitor may show the alarm of apnea. The respiratory rate will be 0. You are seeing some fibrillatory waves in the respiratory waves, which may be due to the pulsatile waves from the heart. So carefully monitor the time. By this time you will have your first ABG value. In this first ABG value, we should calculate for the pH, PCO2. The PCO2 is very important here because once the baseline PCO2 and after test PCO2 that must increased 20 mmHg, then only the ABG will be apnea test will be positive or it will consider as a negative. So carefully monitor for respiratory movement and other parameters like vital signs, blood pressure, heart rate. Any abnormal values like dropping in the heart rate, dropping in the saturation, and dropping in the blood pressure, consider to be that you should stop the test, consider to stop the test and connect the patient ventilator and continue the resuscitation as per the protocol. Keep your crash cart and other emergency trays and your codes ready. Monitor for the oxygen source and connected the tube. Sometimes dislodges may end up in the hypoxia. Watch for the respiratory effort. Before starting the procedure, the patient should be have the arterial line for the easy sampling, and for the central line for the inotrope and other resuscitative measures. Carefully monitor for the urine output also. Okay. Monitor for the time. The estimated time is 10 minutes. The overall procedure will take around 15 to 20 minutes. Keep your emergency resuscitation members ready, crash cart ready. When we can consider this apnea test is positive is we done the ABG at the pre-test level, that is the baseline, you can consider as a baseline. The PgO2 rise from the baseline to the 20 mmHg, you can consider apnea test as a positive. Anything less than 20 you can consider to be a negative. You have to, if you have the negative apnea test, then you can consider as the redo the test after 6 hours. Until you conclude that apnea test is positive, the patient is cannot be a certified as a brain dead. Carefully monitor the victim. The fibrillatory waves in the respiratory monitor, which is showing the pulsatile waves, that is from the heart. The respiratory effort is 0. The monitor is showing continuous apnea alarm in this monitor. Most we crossed 7 minutes. Carefully monitor the respiratory effort and also the other vital parameters. Any deficient in the vital parameters, abandon the procedure and connect the patient to the ventilator. Almost we crossed 9 minutes. We targeted in this video for the 10 minutes. If the patient's vitals are stable enough, then you can consider to continue until 15 minutes. Now the 10 minutes is over. You are collecting the second post-test ABG sample. This is the post-test ABG sample. Once you collected the ABG sample, then almost our apnea test comes to end. As soon as you collected the ABG, we have to connect the patient again into the ventilatory support. Flush the arterial line, then connect the patient to the ventilatory support. Carefully take off that suction catheter, which is we put for the insufflate the oxygen. Connect the patient to the ventilator and ventilate with 100% oxygen for 10 minutes. Carefully monitor for the minute ventilation, respiratory rate, and the tidal volumes. By this time, you will have the two ABG tests. One is pre-test and post-test. Compare the values. If the PCO2 elevation is more than the 20 mm Hg from the baseline values, the difference should be 20 mm Hg. Then the test will be the positive one. Document carefully. Thank you for watching the video.
Number here is there already. Why embarrassing you people not going to learn our responsibility? See, anyway.